Hi guys and namaste. Welcome back to our channel Roc&Deep, and I'm Rakesh.
And I'm Deepa.
And today we're going to talk about depression, one of the most serious mental health illness that can be managed at home and treated medically.
Yes, but if ignored may result in end of life and tragedy.
Yes. But before we start, we want to let you guys know that Deepa and I have been a nurse for more than 8 years, and we have taken care of many patients with mental health illness such as depression, anxiety, and lot others.
Yes, and recently, due to this COVID situation, we have seen an increased number of patients coming with depression, anxiety,
Yes.
suicidal thoughts, especially the youngsters and mid-age people. So we wanted to share our knowledge in this
Yes.
topic.
And we encourage you guys to watch this video till end, because we really want you guys to understand what depression really is, what are the signs and symptoms of depression, what causes depression.
Yes, and we are dividing this video into two parts. On the second
Yes.
part or the second video, we are discussing more about the coping skills, how to manage the symptoms of
Yes.
depression at home. We will be
Treatment
discussing
plans.
about the treatment plans, and also we'll be demonstrating some of the coping skills. So depression is this serious mood disorder where there is an intense feeling of unhappiness, sadness, loss of interest in activities that affect your daily lives. Now, if this kind of feeling lasts for at least 2 weeks or more than 2 weeks, then you most likely you will have a diagnosis of depression.
Okay.
Now, let me clarify you guys one thing. There is a difference between just feeling sad and
Yeah.
actual having a diagnosis of depression. You know, so feeling sad is you might be sad for like a couple hours
Yep.
or even days, but after that you are happy. Whereas the depression, like I said, it will last for at least 2 weeks or more than 2 weeks.
Okay.
The other difference between this sadness and depression is sadness is tied to a specific situation.
Okay.
Like you might be sad about one thing, but rest of the thing in your life you're happy about.
Yes.
Whereas in depression, that is not the case.
Okay.
Everything around you is negative. Like nothing can make you happy. You will have no energy to do anything.
Wow. Well, when you say no energy, it reminded me of one of my patients. I had a patient who really did not even want to get out of his bed.
Right, yeah.
Yes, he didn't even want to brush his teeth, and he did not want to do any activities.
Right, yeah.
And I don't think it was his choice,
Yeah, definitely not. You know, who wants to live that kind of life?
Yes.
So, Rakesh, what causes depression?
Well, depression is a very complex disease, and there are several factors that can cause depression. One of the factors will be biochemistry. So biochemistry means I'm talking about neurotransmitter. So neurotransmitters such as dopamine, serotonin, GABA, acetylcholine, an imbalance in this neurotransmitter can cause depression.
Yes, yeah.
And then the other factor will be hormonal changes, such as estrogen, testosterone, cortisol,
Yeah.
and the imbalance in this kind of hormone can cause depression too.
With the hormone, we
Yes.
can talk about the postpartum
Oh, yes,
depression.
yes.
Usually, the women who have baby a couple weeks or a few weeks or even months after having a baby, the changes in this hormone may
Yes.
result in postpartum depression in many women.
Yes, and the other factor will be genetical factor.
Right, yeah.
So, like if your father have a depression, you are more likely to have a depression, or if your identical twin have depression, you are more likely to have a depression. And also the stressful life event.
Right.
So, if you lost your job, or
Yeah.
if somebody loses their loved one,
Yeah.
you are more likely to have depression. And then I will also say the severe medical condition.
Of course,
Yes, severe medical conditions
Yeah.
such as cancer or stroke, or
Yeah.
cardiovascular disease can result in
Yeah.
depression.
Yep, and personality.
Oh yes,
You know,
that's a big
personality
one.
of a person. Like some has like low self-esteem,
Yes.
or some people can get overwhelmed easily with the
Yes.
small stress of life. This kind of person have more likely to have a depression.
Yes. Deepa, depression doesn't have obvious signs and symptoms like
Yeah.
fever, chill,
Yeah.
rashes, So I think it is very hard to understand who is having a depression.
Exactly, Rakesh. Depression is more about the emotional feeling, how the people are feeling inside, and how
Yes.
they are behaving. So depressed people usually feels helpless,
Okay.
hopeless, worthless. They will have an empty mind, like nothing in their head at all, or they will have a persistent sadness.
Okay.
Some people with depression may feel increased irritability, increased anger or anger outburst,
Yes.
increase in anxiety.
Yes.
So
I've also seen people like having a social distancing.
Right, yeah.
They don't like doing the activities that they used to do.
Yeah.
They don't call their friends. They will not call their family.
Right.
They usually like staying alone by themselves.
They will lose the interest on their hobbies
Yes.
that they used to have pleasure from there, and now they don't at all.
Yes, and you can also see like most of them are gaining weight, or
Right.
they are losing their weight.
There is a change in a sleeping pattern too.
Yes.
Like some might sleep 24 hours or just lay in bed because they have no energy,
Yes.
or some might not be able to sleep at all.
Yes, and they usually have hard time focusing. So decision making is very very hard for them.
Yeah, and sometimes because of this emotional distress,
Yes, yes.
people might complain of stomach pain or
Yes.
muscle pain or headache, stuff like that.
Yeah.
People with a major depressive disorder tends to have suicidal thoughts or even commit suicide.
Wow, you remind me of one of the most stressful event that happened in my life. One of my very close friend, while I was in army, this guy one day called me and he told me, "Hey, I'm having argument with my wife. Can you help me? Can you talk to my wife? She just left me. So just call and talk to her, so you can pass us together." And I was like, "Okay, let me call her." And so I tried to call her and she did not answer the phone. So I told my friend like, "Hey, your wife is not answering phone right now.
Yeah.
Let me call her tomorrow
Right.
and see what we can do, and then we'll talk." And I told him, "If you have any tension, just let me know."
Right.
And this guy told he's okay, but he was kind of tensed.
Right.
And he said, "But I'm okay." So I thought things are good,
Right.
And the next morning I came to know this guy committed a suicide. And I was so sad because I always felt like I could have done something more.
Regret that
Yes,
moment.
I still regret that moment. But I don't think in that short period of time in my phone call I got any clue that he was gonna commit a suicide. Only I knew is he was kind of tensed.
Yeah.
But I thought like things would be okay. But he ended up losing his life. Since my friend committed suicide, I studied a lot about people's behavior before they commit suicide.
Yeah.
And what I found was most of the time people will tell you directly that, "Hey, I'm going to commit a suicide." Or
Yeah.
they will give you a hint, indirect hint.
Indirect hint,
Yeah, they will tell you like, "Hey, I won't be a problem for anybody anymore." Or they will tell you, "If something happens to me, take care of my friends and family." And you can also see there will be change in the legal status.
Oh yeah, they're like having a DPOA.
Yes, yes, and they will start giving their favorite stuff to their friends and family. Yes, they will start writing a journal or suicide note.
suicide note,
Yeah,
yeah.
they will do that too. And most tricky part is all of a sudden they will become happy.
Right. Yeah.
And they are so cheerful.
Yeah, and you wonder why
Yes.
they are so happy after a period of
Depression.
mode.
Yes, but that is because they will have energy to commit a suicide.
Yeah. With that, I wanted to say that people who are taking antidepressant
Yes. Oh, yeah.
medications for depression, usually those kind of medication works around like 2 weeks
Yes.
after taking the medication.
Yes.
That the one of the side effect of antidepressant is suicide. I know it sounds scary, but that is how it works is like you get more energy after
when that medication starts
works,
working. Yeah.
and then you might I have an energy to do something. Finally you are up and you are like on your target of committing suicide. So it's very important to watch yourself, or very important to watch your friends or family who is taking antidepressant or started on antidepressant to watch this time period.
Yep.
So guys, if you see anybody, your friends, family, or even someone that you don't know, but you see this warning sign of suicide, please do not delay and ask a direct question: are you having a thought of suicide?
Yes, or else ask, "Are you going to kill yourself?"
Yeah.
And also ask, "How are you going to kill
Yes,
yourself?"
it's very important to know their plan.
Yes, and never leave those person alone.
Yes. And for those who are having a thought of suicide, please do not delay. Call your friends and family.
Yes, get the immediate help. Call the doctor.
Yes. Call the crisis line.
Yes, call 911.
And also, if you have symptoms of suicidal thoughts, or you have a diagnosis of depression, let your friends and family know what you have in your mind time to time. Let them know that you get suicidal thoughts, and please request them to check on you time to time, because you might not be able to call them.
Yes.
So it's also good that they call you.
Well, thank you for watching this video.
And on our next video, we will be talking more on coping mechanism to deal with these symptoms that causes depression.
And also the treatment plan of depression.
Yep. And then we are demonstrating some of the very good techniques to relax your mind.
Yes. Well, if you guys like our this video, please
Please
like, comment, and subscribe.